The gallbladder is a small, pear-shaped organ located under the liver. Its main function is to store and concentrate bile, a digestive fluid produced by the liver. When food, especially fatty food, enters the small intestine, the gallbladder releases bile into the digestive tract to help break down fats. Bile is composed primarily of water, making up 95% of its total content. The remaining 5% consists of solutes, with bile acids being the major component. These acids act as detergents, helping to emulsify fats for digestion. Other key components include cholesterol, a type of fat present in bile, and bilirubin, a waste product derived from hemoglobin, the protein responsible for carrying oxygen in the blood. Gallstones develop due to an imbalance in the composition of bile. If the liver secretes too much cholesterol or bilirubin, it can crystallize and form stones. Gallstones can take different paths, each leading to different symptoms and complications. 1. Silent gallstones, asymptomatic. Many gallstones remain in the gallbladder without causing symptoms. These stones are often found incidentally during imaging for another condition. 2. Symptomatic gallstones, biliary colic. If a stone temporarily blocks the cystic duct, which drains bile from the gallbladder, it causes biliary colic, a sharp, intermittent pain in the upper right abdomen, especially after fatty meals. Symptoms resolve when the stone moves back into the gallbladder. 3. Cholecystitis, gallbladder inflammation. When a stone permanently blocks the cystic duct, bile builds up, leading to fever and severe pain. Choledocholithiasis, stone in the common bile duct. If a stone moves into and blocks the common bile duct, it can cause jaundice, dark urine, and pale stools. Cholangitis, bile duct infection. A blocked bile duct can lead to a severe infection, causing fever, right upper quadrant abdominal pain, and jaundice. Pancreatitis, inflammation of the pancreas. A stone blocking the pancreatic duct can lead to acute pancreatitis, causing severe abdominal pain and vomiting. Several factors increase the likelihood of developing gallstones. These include biological factors, age, more common in people over 40 years old, gender, women, especially those who are pregnant, on birth control pills, or undergoing hormone replacement therapy, have a higher risk due to estrogen's effect on bile composition. Genetics, a family history of gallstones increases the risk. Lifestyle and dietary factors. Obesity, excess body weight increases cholesterol levels in bile, making stone formation more likely. Low fiber, high fat diet. Diets rich in processed foods, unhealthy fats, and low in fiber contribute to gallstone development. Medical conditions. Diabetes. High triglyceride levels in diabetics increase gallstone risk. Liver disease affects bile production and bilirubin levels, contributing to stone formation. Hemolytic disorders. Conditions like sickle cell anemia lead to excess bilirubin, increasing the likelihood of pigment gallstones. Metabolic syndrome. Conditions like high blood pressure, high cholesterol, and insulin resistance increase the risk. Medications and hormonal factors. Hormone therapy and birth control pills increase estrogen levels, which can raise cholesterol levels in bile. Cholesterol-lowering drugs. Some medications increase cholesterol excretion into bile, raising gallstone risk. Certain antibiotics, ceftriaxone, can lead to calcium bilirubinate stone formation. The treatment for gallstones depends on the severity of symptoms, complications, and overall health of the patient. Asymptomatic gallstones, which do not cause symptoms, typically require no treatment. In such cases, a watchful waiting approach is recommended. This means that as long as the gallstones do not lead to pain or complications, no medical intervention is necessary. However, if there is a risk of future symptoms, regular follow-up may be advised. Additionally, adopting a healthy lifestyle. A low-fat diet is advised to minimize gallbladder stimulation, while gradual weight loss, rather than rapid weight reduction, helps prevent stone formation. Regular physical activity further supports metabolism and bile flow, contributing to overall gallbladder health. Other than basic treatment like pain management and antibiotics, oral dissolution therapy using ursodeoxycholic acid, UDCA, or ursodiol, which helps dissolve cholesterol gallstones, though it is ineffective for pigment stones. This treatment requires months to years of therapy and does not always prevent recurrence. It is generally used for patients who are either unfit for surgery or prefer a non-surgical option. Surgical removal of the gallbladder is recommended when symptomatic gallstones cause frequent or severe pain, lead to complications, or pose a high risk of future health problems.